This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Well, thank you, Jason. I will share my screen. All right. All right, and just to confirm, y'all can see my screen, you can hear me, and then we'll get started. I'm gonna take that as a yes. All right, so my name is Megan Kennelly. I am a fourth year chief resident here at Carolinas Rehab, and I'm also joined tonight by one of our PGY3s, Andrew John. So he is also on. He's gonna help us kind of walk through and give y'all a little overview of our program and try to, at least give y'all a little piece and look into the program that we chose and why we think it's so great. But just a little overview of what we're going to be talking about tonight. So we'll start with just an overview of our faculty, who the key players are that you'll need to know. Then we'll move into our curriculum and our academics, move into some of the extracurriculars that we do here and that we offer. And then of course we have to talk about why Charlotte, why it's the best, and then also just some future directions of our program. And so of course you have to start off with our administration. Our program is led currently by Dr. Kelly Crawford. She's our program director, and we have our assistant residency program director, Dr. Shao. And of course our department chair is Dr. Bachnick. All three have been here at Carolinas Rehab for some time, and we feel like with their leadership, our program is moving, upwards and onwards and in the right direction. But of course, we also have other faculty that we work with. When you're on your rotations, you're gonna, come in contact with these beautiful faces. And so this is just some of our core faculty. We do have, of course, other attendings, but just wanted to call attention that, at Carolinas Rehab, we have a brain injury department and brain injury fellowship that's led by Dr. Desai. We've got Dr. Lofton, who is our fearless leader for spinal cord injury. Dr. Sai is our pediatrics director. We've got Dr. Pugh, who directs our cancer program. And we also have a cancer fellowship, which is led by Dr. Raj. And of course, we have Dr. Hirsch, who is our research director. And so we really have a nice, strong, diverse, I feel like, faculty who we have every different, subspecialty of rehab that you would ever want. And so just see those faces of, our friendly faculty so that you also have some names going into interview day possibly. And our program is made up of 5 residents per class. And so we're both an advanced and a categorical program. So we offer 3 advanced spots, which is just, for those 3 rehab years. And we do offer 2 categorical PGY1 positions. And so you don't have to interview separately for those categorical PGY1 positions. That's offered through the program. And we just added one of those second categorical spot recently. And so that's a really great option for people as well. And this year we also have a brain injury fellow and a cancer rehab fellow. And in this upcoming year, we hope to have a spinal cord injury fellow. So it's just the right size program where you feel like you have lots of different, you've got different colleagues to split up the call schedule with, a lot of different personalities, but then also still a tight knit group because, there's only 5 of us each year, but definitely the right size. And that's essentially what I was looking for. And our residents come from all over the country. We're not necessarily pulling from just, the Southeast. I do want to add in a little humble brag that I put in these stars just based off memory the first time, and that was actually pretty close. So our residents come from all over the country because, Charlotte's such a great place. But also they're attracted to our program because of our facilities. So our main spot where you would be located is Carolinas Rehab, which Carolinas Rehabilitation has some of the highest complexity. We get spinal cord injury, brain injury, stroke, cancer. And really in the area of Charlotte, we are the main trauma 1 center, and we get, different referrals in from outside the area. So you're really seeing high complexity, high acuity, large volume, which is very nice. We have 12 CARF accredited programs across our Carolinas rehab system. And we also apparently were the first CARF accredited cancer rehabilitation program in the world. So I know that our program is very proud of that. And we take pride in really all the subspecialties that we have. And one of the other pieces that we wanted to touch on is that here at Carolinas Rehabilitation, we always have a hospitalist on call. There's a hospitalist that follows every rehab patient. And so I remember when I first looked into, different rehab programs, I'm someone who wants to do inpatient rehab in the future. And so when I saw that there was a hospitalist, it's like, oh, maybe I won't get as good of an inpatient rehab experience then, but it really is nice to have that hospital support. They let you take as much, control as you want, be as involved as you want. So if you want to be able to really work on that hospitalist side of the medicine, you have that opportunity, but it is very nice to have their support, especially on call. And so we rotate not only at the main Carolinas rehab, but we also have a couple of other sites around the city. And our main inpatient sites, though, primarily are that main Carolinas rehab in Charlotte. We've got Carolinas rehab out in Mount Holly, which is really only about 20 minutes away, but traffic is always very nice out that way. And then we also rotate at Carolinas Medical Center, which is just adjacent to Carolinas rehab. We walk over there for the cafeteria every day. And same with Levine's Children's Hospital, which is included in Carolinas Medical Center. So fairly nice, compact area for our inpatient rotations. And I feel like with any residency program, our outpatient sites do vary a little bit. We get to go out and rotate in your, the sports medicine and injury clinics, which you're going to rotate out on there on our sports rotation, your MSK rotations. Those can be kind of all across the city, but really not too bad. We also get the opportunity to rotate at the VA, which of course you're going to have just a whole different population out there. I'm really glad that we get to work with that population. And then you also get to go to Ortho Carolina, which is where we get a lot of our EMG exposure. And so just a little breakdown of our curriculum over the years. I feel like we do a really nice job of splitting up our inpatient and outpatient rotations so that you're not doing all inpatient in your second year. So I did want to bold our inpatient rotations. And so in your second year, typically you're going to get most of your core rotations with 2 months of TBI, stroke, spinal cord, and that's consecutive those 2 months. So you really do get a sense of, your patients, you start feeling confident that second month, and then you can carry forward and really build on what you've been learning. And so aside from those core rotations, you also get to do a month of consults, which typically we like to pair you up with 3 or 4 who's also on the rotation. So it's a nice way to kind of ease you into that consult situation. You get to see patients before they come to rehab, get a better sense of who's a candidate for rehab. And it's a good experience overall. But then we also sprinkle in that second year, you get to do some pain and palliative, which is all outpatient and great exposure to, really to palliative medicine. That's a very nice rotation and then you also get a little exposure to EMG, outpatient VA, and therapy. So you'll get to shadow our therapists and see what they're doing, get to know, really all the modalities that they use that then you can carry forward in your inpatient rotations. But that is a recent change that we've made to move the therapy rotation to second year. That's something that we did as a class. We thought that therapy, exposure needed to be earlier. So now it's in the second year versus in the fourth year where it was previously. And then in our third year rotations, typically, then you get to go back and be a junior supervisor, which is one of my favorite parts. So you start off in July doing the same inpatient rotation that you did as a second year, and you work with the new incoming second year. So it really is a great chance for mentorship and then helping them just ease the process, as they switch from internal medicine to rehab. And so it's a nice little transition from intern year. And then also you get to go back to, whatever rotation you were before and also solidify some of those concepts. And of course, third year, you get to do 2 months of pediatrics. You get to then get some exposure to the inpatient MSK AMP side. And then that also pairs up with an outpatient P&O rotation where you get to go and shadow some of the prosthetists, the orthotists, which that's also a very fun rotation. You do another month of consults, which you do a month of consults each year. And we also have that that longitudinal exposure to EMG in each year as well. And then you also get an elective in third year, which is very nice. They're so flexible with what you can do. It's really, you can do anything from making, I like pediatrics, so I did outpatient pediatrics, but then I know people have arranged for doing some global health trips or going through and just really being creative. If you want more interventional spine or MSK exposure, they're very flexible with our electives. And you do get 2 electives in your 3rd year and 3rd or 4th year, but 4th year really moves to more of that outpatient kind of fine tuning, what you want to do. So you get the 2 electives. You do have a little bit of inpatient cancer exposure, which we are moving that up to the 3rd year. That's our plan for next year. So this is actually a little out of date, but in the future, we hope to move cancer forward. And then you get those experience, you get clinic, you get outpatient VA, you get sports. And so I guess really the essential of the slide is that you get some good exposure, both inpatient, outpatient each year. And we feel like we're doing a good job of kind of making it match your progression throughout your residency, which, all right, I'm done talking about curriculum. That's probably too much curriculum, but outside of your normal rotations, we do also offer some nice academic endeavors. And so we do noon lectures. So it's 1 hour each day, Monday through Friday, where it's protected time. All the pages that you're getting are forwarded to your attending. And so those noon lectures can vary between attending led. We have some guest lecturers that come in from time to time, and then also resident led lectures as well. We also have a resiliency curriculum. We do have a diversity and inclusion group, which I was not involved in this year, so I can't speak to it, but Dr. John may be able to speak to it. And then we have an ultrasound curriculum and fluoroscopy workshops, which is someone who's not interested in MSK and spine. Those aren't my favorite, but I know that the residents and the attendings that work on those workshops, they are, so committed and they are so thorough. And so it's nice that we do have that exposure. It's something that you get to go to repeatedly each year. So then each year you can kind of build on those skills and then also try to solidify what you've learned. And then of course, we also have research opportunities. It's not required. So no one has to do a research project. Of course, everyone has to do a QI project because it's required by the AV PM&R, but research is not, but there are lots of projects available and attendings are always happy to help. I know that we have various Parkinson's, stroke, brain injury. There's always projects going on that you can get involved with. And I think that has been enough of academics and curriculum. So I'm actually going to let Dr. John now talk about more fun things, because these are the things that I feel like make our program really what it is. So Dr. John, if you would like to talk about the more fun parts of the program.
Yeah, thanks, Megan, for doing such a good job covering all the kind of other important nuts and bolts of the program. Hopefully everyone can hear me okay. My name is Andrew John. I'm a PGY3 here at Carolinas Rehab. And yeah, so I will take over for now, talking about the other side of our program, the less kind of academic-y things. And I think a lot of programs will have, various things that are the extracurriculars. Some of the fun stuff with ours, as demonstrated on the slide that Megan has right now. Every year we have what's called like it's called MedFest. It's essentially like a kind of a mini version of like the Special Olympics for different kids in the community and the surrounding area with different sort of levels of function and disabilities, and helping basically with that event. So we kind of just help out on the medical side of things, but it's always fun to kind of see all the kiddos and work with them. And so that's something that a lot of our faculty, especially like our PEDS faculty, are very passionate about. So we've been involved with that historically. So that's like a picture of us helping out this year. And then there's other different volunteer events. In addition to that, we have several faculty that are very passionate about different sort of outreach events, it can be medical or non-medical. Some of them are involved with like more clinic-y type of things in terms of working in areas that with patients that may be underserved, but there's also things that are just like purely like non-medical that we still volunteer with. So like, for example, we have a creek that runs right by the hospital that is very nice, but on occasion it can get a little bit less well kept. And so we will volunteer to do like a creek cleanup sometimes for that. And so there's other things that we'll do. One of the cool things that we do like with the more medically, going back to like the rehab stuff, is those last two bullet points on the slide: adaptive sports and cycle to the sea. So Our ASAP program is our adaptive sports program local to the area. And so we have a lot of patients that are referred to that essentially they get to figure out and learn more about and explore the world of adaptive sports, which I think is always super cool, especially with like the ingenuity that people have and being able to like empower our patients to still be involved in athletics in some capacity. So that's always fun. And while you're actually an inpatient, you're often encouraged to join them because we'll have our inpatient patients go over and kind of get a little bit of a intro sesh to that. So that's always fun. And then Cycle to the Sea is a fundraiser where we basically bike ride to the beach from Charlotte. I think it's like something like, don't quote me on this. It's like something to 60, 90 miles per day that they're cycling every day to reach the coast. And yeah, it's a time where you get to kind of just hang out. And some of the participants in that are actually adaptive athletes. So they're like hand cycling while some other people are just regular cycling and they're like kicking our butts. And so they're quite impressive. Liver Rounds is another thing that we do every month where it's just essentially a happy hour event with the residents and faculty just to kind of encourage camaraderie and all that. So good times. Moving along, Megan, if you could click the next slide.
Yeah, I forgot that was my job for a second, but I got it now. I got it.
Okay. Briefly over call schedules. These are kind of more nuts and bolts. They're not super exciting, but essentially, long story short, we have home call. And what's unique about our program is despite having home call, we still get post call the next day. Oftentimes you'll find that post call typically only comes with having an in-house call. So that's a nice, really nice perk. You're covering all the hospitals, which can sound really daunting, but it's actually not too bad. And then essentially you get less and less call as you advance the program. So the PGY2s cover the weekends, and then PGY3s will cover like Fridays in addition to other days. And then as a 4, you just have, sporadic call here and there. So it's pretty sweet. And then some other cool little perks throughout our program. I already mentioned the post call, and we do have built-in moonlighting opportunities. So that's really nice that you don't have to do any extra legwork to kind of figure that out. Being in PM&R, it's really nice that our schedules are not too insane or crazy to that allow us to have opportunity that if we wanted to make a couple extra bucks on the side, we can. And so we have moonlight opportunities that are already built in. And then those are all like the other cool little things in those other bullet points of that our kind of governing overarching supervising hospital system, Atrium Health, they like take care of all that stuff, which is really good. We get really nice perks for like investment accounts and parking and a lot of money for food. And then Charlotte's pretty cool. I think I'm running out of time pretty soon, but Charlotte's pretty awesome. It's a huge city, constantly growing, and there's a lot of people that have moved into the city from other parts because cost of living is actually really nice compared to other places on the East Coast, especially. And because of the influx of people, that means that there's more fun things to do and more good food places that are popping up. And so it's just a really booming city. And so there's plenty of fun things to do, whether you want to like, go out to eat and check out the really good food scene. It's very eclectic here. And then, or if you want to like get out to nature, we have a very good, easy access to the outdoors, like listed there. We have the cool White Water Center, which is where like people will train for like the Olympics, but also if you want to take it easy, they have really like chill things too. And so if you just want to go hiking or go for a nice kayak ride, they have that as well. And we're not too far away from either the beach or to get out to the mountains too. And so very easy access to either one of those. And then this last little bit is a picture referencing our brand new rehab hospital that is set to open and be operational in the upcoming months. It's set to be fully operational with all patients moved over there by January. And so it's really nice, and they have taken into consideration all the stuff that people have given feedback about, all of the rehab stuff that we've experienced so far. And so it's nice to have like the kind of the cutting edge technology and all that stuff that's going to be available to us. So we're looking forward to that. So yeah, that's a kind of a brief overview. Hope that was informational for all of y'all. You can follow us at our social handles at those usernames. And yeah.
Yeah, I think we just barely made it. I don't know if the plan, Jason, is to have questions at the end or if people can put questions in the chat. I know I feel bad that we spent way too much time on curriculum.
Well, yeah, I mean, you guys have about a minute to answer questions in the chat, and then folks can ask questions in the chat afterwards as well.
All right, I'm gonna try to address these rapid fire then. All right, first question is the benefits of pushing therapy. It just basically helps us know like what we're actually doing with, like whenever we say like, oh, the therapist can do blah, blah, blah. Like we have that so that when we go on inpatient, there's different little modalities that we can recommend for the therapist or for our patients to do. So that's very helpful to have earlier on instead of being like a fourth year. It's like, oh, I didn't know they could do that. All right, next question. How much do the residents hang out with each other? Basically every week, if not multiple times throughout the week, because people do stuff all the time. Residents have kids and families. There's basically a baby in every class. Almost everyone has a significant other. So there's like a different blend and people are different like life stages, some like long-term married, some like very serious ongoing relationships, some new relationships. So it's all over the spectrum. Hitting procedure numbers, absolutely not. In fact, for like spinal procedures and stuff, we like match all our spine folks every year. And for EMGs, we like crush those numbers. So anything with procedures, we always crush.